Welcome to this deep dive on revitalizing the NHS. I gotta say, that disclaimer about the book being AI generated kind of threw me. AI for the NHS. It's like we're living in a Black Mirror episode, isn't it? Makes you think. What are your thoughts on that?
It's certainly a sign of the times, blending AI and healthcare. The book does a good job of showing both the potential and the serious things we need to think about, definitely.
Definitely. And speaking of the NHS, for anyone who might not know, it's the UK's publicly funded healthcare, been around for over 75 years, point of pride, really. But like anything with a long history, it's facing some big hurdles, wouldn't you say?
Absolutely. The book doesn't shy away from that at all, does it?
No, not at all. Comes right out and says the NHS is at a crossroads, aging population, rising costs. We've heard it before, but it's more urgent now than ever. And then Brexit's impact on staffing just adds fuel to the fire.
And it's not just numbers, is it? It's people. Longer waits for procedures, trouble getting specialist care. Those are real anxieties, not just statistics. The book makes a good point. The NHS is facing its greatest challenge since it began. Transformation isn't a choice anymore. It's needed for survival.
Wow, that's powerful. And true, it's not about preserving a system, it's about people getting the care they need when they need it. Which brings us to another thing the book digs into, integrating health and social care. I've seen firsthand how frustrating that disconnect is. Seems like it has real consequences, right?
Absolutely. Yeah. It creates inefficiencies, people not getting the care they deserve, like a puzzle with missing pieces. The book's argument is that real integration isn't just improving services, it's a whole new approach to health in our communities.
Right, it's not just health, it's well-being, it's bigger. And that makes it clear that the solutions aren't going to be simple either.
Definitely not.
One more thing that really struck me, especially given the NHS's commitment to equal access, is the persistence of health inequalities. It's, well, disheartening's the word, after all this time.
It's a complex problem, deep roots. We need to look at the social factors, systemic biases, making sure everyone has a fair chance at a healthy life.
It's about a system that truly works for everyone, no matter what. So we've covered the challenges. The NHS needs some serious help. But the book doesn't just leave us hanging, does it? There's a roadmap, a blueprint for the future, right? 5 key pillars, if I remember right.
It does. And they're not just ideas, they're like actionable strategies, which I thought was good.
Exactly. Solutions, not just problems.
Yeah.
So let's dive in. That first one, harnessing data and digital technologies, seems kind of futuristic, but also exciting,
It does have that ring to it, right?
Yeah.
The NHS using data for better, more personalized care.
Okay, paint me a picture. What does that look like for the average person?
So you go for a checkup. No more basic questions. The doctor's got insights from your history, your smartwatch, even genetic stuff, all analyzed just for you.
That's wild, like having, I don't know, a team of invisible experts working for you. But what about folks who aren't tech savvy or can't afford the latest gadgets?
Crucial point. The book stresses equal access, making sure these advancements help everyone.
Right. We don't want a two-tiered system, only the rich benefit.
Exactly. Bridging the digital divide, they call it, making sure these solutions are usable no matter your tech skills or income.
Okay, so AI to help doctors, not replace them. But will we lose the human touch in all this?
The million-dollar question. And the book's clear. Human connection, empathy, that's still core to good healthcare. Tech should enhance, not replace that.
I like that. Where tech and compassion meet for the best patient experience. Next up, optimizing the NHS workforce. Something we can all relate to. Shortages, burnout, it's no secret healthcare workers are under huge pressure. What's the book's angle on fixing this?
It flat out says, a healthcare system is only as good as its workforce. And right now, the NHS is struggling.
It's heartbreaking. They're the ones caring for us when we're most vulnerable.
One idea is moving away from the career ladder towards a career lattice. So, healthcare workers can move horizontally, try different things, maybe rediscover their passion.
No, that's smart. Recognizes that people change, their interests change. It's a way to keep great people in the NHS.
Exactly. A more flexible workplace that values what everyone brings to the table.
Makes you wonder how much talent is lost because the system's too rigid. It's not just attracting new people, it's keeping the amazing ones we have.
You got it. The book stresses investing in staff well-being, their development. It's not just nice, it's necessary for the NHS to survive.
All right, on to pillar 3, reimagining patient-centered care. Sounds self-explanatory, but what's that mean in reality?
Shifting from one size fits all to truly putting the individual first.
Okay, so less ticking boxes, more treating each patient as a person.
Exactly. Personalized medicine, treatments tailored to you, your genes, lifestyle, leading to better outcomes, and maybe even avoiding unnecessary procedures.
Wow, that's huge. No more being a number on a chart.
Right. It's doctors and patients working together, sharing information, making decisions as partners. There's an example in the book. A patient with a complex condition gets a personalized care plan. Not only did their health improve, it saved the NHS money in the long run.
So personalized care is potentially better for everyone. That's a win-win. Okay, let's talk about the elephant in the room, sustainable funding and resource allocation. How do we make the NHS financially stable long term?
And this is where it gets really interesting. The book argues it's not just about more money, it's about smarter spending, new ways of funding things.
Like what? I need an example. This is big picture stuff.
Okay, imagine a program to reduce hospital readmissions for, say, elderly patients.
Yeah.
Private investors fund it. If it hits its targets, like a certain percentage reduction, they get repaid with interest by the NHS.
So it's about incentives for positive outcomes. That's a new way to think about it.
Exactly. Shifting from paying for how many patients a hospital sees to rewarding them for keeping people out of the hospital.
Now that makes sense. Prevention over reaction, right?
Yeah.
Keeping people healthy, not just treating them when they're sick.
Exactly. It's about value, not just volume, which is a big theme of the book. It's not about how many patients you can cram in. It's about the best results for every pound spent.
Okay, I can get behind that. Last but not least, we've got fostering cross-sector collaboration. Seems obvious, but why is it so tough to get right?
Because it means breaking down silos. Always hard in a big system. We're talking better integration between health and social care, using private sector ideas, even looking at what other countries are doing.
It's realizing the NHS doesn't have all the answers, and working together is key.
Right, like what if a tech company made a really good telemedicine platform so people in rural areas could meet specialists without traveling?
That would be huge for people who can't easily get to those appointments.
Or partnering with universities to develop new treatments.
Mm-hmm.
The possibilities are huge when we stop working in isolation.
I like the sound of that. Using the best of everyone's strengths for a world-class healthcare system. This has been, wow, eye-opening, to say the least. We've just scratched the surface of these pillars, but I already have a better grasp of what could be done to transform the NHS. You know, thinking about these pillars, it strikes me there's this tension between keeping the NHS's legacy and, well, really shaking things up. Like walking a tightrope, tradition on one side, innovation on the other.
It's a balancing act, for sure, and the book makes that clear. Not about ditching the core values, it's building on them, adapting for the 21st century.
Right. Evolution, not revolution. Taking what's great about the NHS and adding new ideas, new ways of doing things.
Exactly. Like, the book talks about integrating technology, but doing it carefully. They even warn about digital solutions making inequalities worse if we're not careful.
That's a good point. I hadn't thought about it like that.
Yeah, imagine telehealth, but it's only accessible to people who can afford it or are good with tech. Defeats the purpose.
Totally. It's not enough to just have the technology. It's got to be accessible to everyone, or it's not really fair.
Exactly. And that's just one example. There's so many factors to consider, which is why the book emphasizes getting everyone's perspective, not just a top-down approach.
Yeah, it talks about all the different stakeholders, right? And how important it is to consider their viewpoints.
It's not just about the government or the NHS leaders. It's about the patients, the doctors and nurses, even the private sector.
Right, and researchers and everyone in between. It's a huge collaborative effort.
Absolutely, because at the end of the day, it's about people. The book really drives that home.
It does. And this deep dive has given me a lot to think about. Revitalizing the NHS, it doesn't sugarcoat the challenges, but it does offer hope. With the right ideas, collaboration, and remembering why the NHS exists in the first place, there's a brighter future possible.
It's not just about saving a system. It's about safeguarding health and well-being for everyone, for generations to come.
Well said. And if this conversation has got you thinking about the future of the NHS, I highly recommend checking out Revitalizing the NHS, a comprehensive blueprint for sustainable healthcare. It's a call to action for all of us to get involved, to think critically, and to work towards a healthcare system that truly serves everyone. Thanks for joining us on this deep dive. It's been a pleasure exploring these important ideas with you.